Dear friends, today we are presenting a topic that keeps the same importance that other healthcare topics do, and it is about ADHD, that is Attention Deficit Hyperactivity Disorder. Undiagnosed, untreated attention deficit hyperactivity disorder, or ADHD, can wreak havoc on your life, and it can also impact your loved ones. Each year, we recognize ADHD Awareness Month in October is a time to celebrate the progress made in ADHD education and advocacy, understand the work that still needs to be done, and raise awareness about the importance of early diagnosis and treatment. Without ADHD awareness, many children and adults continue to struggle. Things we will going to discuss about ADHD are: why ADHD awareness is so important. What is ADHD? What are the symptoms of ADHD? ADHD versus ADD. What are the causes of ADHD? How is ADHD diagnosed and tested? How is ADHD treated? So let's start it with why ADHD awareness is so important. Estimates show there are over 10 million people in the U.S. with ADHD, based upon prevalence studies and the 2010 census data. ADHD is also one of the most common disorders of childhood. Despite this, there is a huge amount of bad and misleading information on the internet and in the media about the condition. In addition, there are people with ADHD who have never been diagnosed, but have lives filled with problems directly related to the symptoms. What is ADHD? Attention Deficit Hyperactivity Disorder, or ADHD, is a brain disorder that affects how one pays attention, sits still, and control his or her behavior. It happens in children and teens, and can continue into adulthood. ADHD is the most commonly diagnosed mental disorder in children. Boys are more likely to have it than girls. It's usually spotted during the early school years, when a child begins to have problems paying attention. ADHD can't be prevented or cured. But spotting it early, plus having a good treatment and education plan, can help a child or adult with ADHD manage their symptoms. What are the symptoms of ADHD? Symptoms in children are grouped into three types: inattentive, hyperactive-impulsive, and combined. Let's discuss them one by one. In inattentive type, a child with ADHD is easily distracted, doesn't follow directions or finish tasks, doesn't seem to be listening, doesn't pay attention, and makes careless mistakes, forgets about daily activities, has problems organizing daily tasks, doesn't like to do things that require sitting still, often loses things, and tends to daydream. In hyperactive-impulsive type, a child with ADHD often squirms, fidgets, or bounces when sitting, doesn't stay seated, has trouble playing quietly, is always moving, such as running or climbing on things. In teens and adults, this is more often described as restlessness, talks excessively, is always on the go, as if driven by a motor, has trouble waiting for their turn, blurts out answers, and interrupts others. Third one is combined type, which involves signs of both types. Symptoms of ADHD may change as a person gets older. They include often being late or forgetting things, anxiety, low self-esteem, problems at work, trouble controlling anger, impulsiveness, substance misuse or addiction, trouble staying organized, procrastination, easily frustrated, often bored, trouble concentrating when reading, mood swings, depression, and relationship problems. Next, we will compare ADHD with ADD. Attention Deficit Disorder, or ADD, is the old name for ADHD. It was officially changed in the 1990s. Some people still use both names to talk about this one condition. What are the causes of ADHD? Let's discuss. Experts aren't sure what causes ADHD. Several things may lead to it, including ADHD tends to run in families. Brain chemicals in people with ADHD may be out of balance. Areas of the brain that control attention are less active in children with ADHD. Poor nutrition, infections, smoking, drinking, and substance abuse during pregnancy, these things can affect a baby's brain development. Toxins, such as lead. They may affect a child's brain development. Damage to the front of the brain, called the frontal lobe, can cause problems controlling impulses and emotions. Sugar doesn't cause ADHD. ADHD also isn't caused by too much TV, a stressful home life, poor schools, or food allergies. How is ADHD diagnosed and tested? It can be hard to diagnose ADHD, especially in children. No one test will spot it. Doctors diagnose ADHD in children and teens after discussing symptoms at length with the child, parents, and teachers, and then observing the child's behaviors. Doctors use the American Psychiatric Association's guidelines, which are based on how many symptoms a person has and how long they've had them. They'll also rule out other things that may be causing the symptoms, such as health conditions or problems in daily life. To confirm a diagnosis of ADHD or learning differences, a child may take a battery of tests to check their neurological and psychological status. The tests should be given by a pediatrician or mental health provider with experience in diagnosing and treating ADHD. The primary care doctor might refer the individual to a specialist, such as a psychiatrist, psychologist, or psychotherapist. The tests may include a medical and social history of both the child and the family, a physical exam and neurological assessment that includes screenings of vision, hearing, and verbal and motor skills. More tests may be given if hyperactivity may be related to another physical problem. An evaluation of intelligence, aptitude, personality traits, or processing skills. These are often done with input from the parents and teachers if the child is of school age. A scan called the Neuropsychiatric EEG-based assessment aid or an EBA system, which measures theta and beta brain waves. The theta-beta ratio has been shown to be higher in children and adolescents with ADHD than in children without it. How is ADHD treated? There are several approaches to treating ADHD, but research suggests that, for many children, the best way to manage symptoms is a multimodal approach. This involves multiple methods of treatment that work together. Many symptoms of ADHD can be managed with medication and therapy. Close cooperation among therapists, doctors, teachers, and parents is very important. Although there is controversy about their possible overuse, stimulants are the most commonly prescribed medications for treating ADHD. They can help control hyperactive and impulsive behavior and improve attention span. They act on the brain chemicals, like dopamine, that can make impulsive behavior worse. They include amphetamine, having brand names Adzenys XR-ODT and Dianavel. Dexmethylphenidate with brand name Focalin. Dextroamphetamine sold under brand names Adderall and Dexedrine. Lisdexamphetamine with brand name Vyvanse. Methylphenidate having brand names Aptensio, Cotempla, Concerta, Daytrana, Duray PM, Metadate, Methylene, Quilivant, and Ritalin. Stimulant medications don't work for everyone with ADHD. People older than 6 may take non-stimulant medications such as atomoxetine with brand name Strattera, clonidine having brand names Catapres and Capve, guanfacine sold under brand name Intuniv. In some cases, doctors may prescribe antidepressants, such as drugs called SSRIs, bupropion having brand name Wellbutrin, or venlafaxine sold under brand name Effexor. Side effects of ADHD medicines can include anxiety, loss of appetite, fatigue, crankiness, trouble sleeping, skin discoloration with patches, upset stomach, and headache. Most side effects are minor and improve with time. In some cases, doctors may lower a dosage to ease side effects. In rare cases, stimulants can have more serious side effects. For instance, some are linked to a higher risk of heart problems and death in children with heart disease. They may also make psychiatric conditions, like depression or anxiety, worse or cause a psychotic reaction. Before your child starts an ADHD medicine, talk to your doctor about the risks and benefits. Remember that it can take some trial and error to find the right medicine and dose. There are treatments that focus on changing behavior, such as special education helps a child learn at school. Having structure and a routine can help children with ADHD a lot. Behavior modification teaches ways to replace bad behaviors with good ones. Let your child know what behaviors you expect of them. Make simple, clear rules. When they lose control, have them face consequences that you've set up, like timeouts or losing privileges. Keep an eye out for good behavior. When they keep their impulses in check, reward them. Psychotherapy or counseling can help someone with ADHD learn better ways to handle their emotions and frustration. It could help improve their self-esteem. Counseling may also help family members better understand a child or adult with ADHD. Social skills training can teach behaviors, such as taking turns and sharing. The FDA has approved the Monarch External Trigeminal Nerve Stimulation or ETNS system for children 7 to 12 who aren't taking ADHD medications. It's about the size of a cell phone and is attached to electrodes on a patch that you put on a child's forehead. It sends low-level impulses to the part of their brain that's thought to cause ADHD. The device is usually worn at night. Support groups of people with similar problems and needs can help to learn more about ADHD and how to manage symptoms. These groups are helpful for adults with ADHD or parents of children with ADHD. Educating parents about the disorder and its management is another important part of ADHD treatment. This may include learning parenting skills to help a child manage their behavior. In some cases, the child's entire family may be involved. Dietary supplements with omega-3s have shown some benefit for people who have ADHD. A few lifestyle changes can also help you or your child manage symptoms. Eat a healthy diet with lots of fruits, veggies, whole grains, and lean protein. Get some exercise every day. Studies find that exercise helps control impulses and other behavior problems in kids with ADHD. Think about signing your child up for a sports team, such as basketball, soccer, or baseball. Playing a sport not only gives kids exercise, it teaches them important social skills, such as how to follow rules and take turns. Limit time spent on electronic devices. Get plenty of sleep. Simplify your child's room to lessen distractions, like toys, and improve organization. It's common to get frustrated when you're raising a child with ADHD. You'll feel more in control if you take an active part in your child's treatment. It may help for you too. Keep a clear schedule and routines. Talk to your child simply and honestly about what you expect from them. Make instructions simple and specific, like brush your teeth. Now, get dressed. Instead of general, get ready for school. Focus only on your child when you're talking to them. Be an example of calm, focused behavior. Be consistent with discipline, and make sure other caregivers follow your methods. Reward good behavior. Boost your child's self-esteem. Because they may have trouble processing directions and other information, they may be bombarded with corrections, leaving them with a low opinion of themselves. Do whatever you can to boost your child's self-esteem. Encourage your child's special strengths, particularly in sports and out-of-school activities. Learn as much as you can about ADHD and impulsive behaviors. Keep in close contact with your child's doctor, teachers, and therapists. Join a support group to learn from other parents who have been through the same problems. Without treatment, ADHD can make it hard to deal with the challenges of everyday life. Children may have trouble learning or developing social skills. Adults could have problems with relationships and addiction. The disorder could also lead to mood swings, depression, low self-esteem, eating disorders, risk-taking, and conflicts with people around you. But many people who have ADHD live happy, full lives. Treatment helps. It's important to keep track of your symptoms and see your doctor regularly. Sometimes, medication and treatments that were once effective stop working. You may need to change your treatment plan. Some people's symptoms get better in early adulthood, and some are able to stop treatment. So that is all for today. We really hope that you liked our presentation. We will come up with more health topics to increase the awareness about less discussed or rarely discussed health issues. Till then, take good care of yourself.